Okay, good afternoon, good morning, wherever you are. Thank you so much for joining and putting your time for this important conversation. My name is Gracia. I am from Bolivia. I am a person living with HIV. Now I am working with the World Council of Churches leading the HIV, Reproductive Health and Pandemics program. Today, we are going to discuss what is a safe space for young people in faith communities. It's a very important discussion for the World Council of Churches because we want to do what is meaningful for young people. So today we have prepared a webinar, which is a discussion. We will have some models that we are going to study a little bit, and then we will hear from young people. They will tell us what they expect, and also people participating on the webinar will have the opportunity to say their opinion or participate on the chat about safe spaces. And so we will begin with an opening prayer, then we will hear the objectives, and then three models, one from the World Council of Churches, one from UNAIDS, or perspectives from UNAIDS, one from the Young Women's Christian Association. Then we have a panel of three young people. They are from Nigeria, Togo, and South Africa. And then we have an open forum and brainstorming about the characteristics of a safe space. So I will start introducing Reverend Christo Grayling. He is a former Senior Director of Church Partnerships in World Vision International. He's living with HIV since 1987, and he became the first Southern Africa faith leader to disclose his HIV status in 1992. Later on, he joined World Vision International, from which he retired recently. He led and he created the program Channels of Hope, which was able to reach about 50 countries and many people around the world, working not only on HIV, but also child protection, maternal and child health, gender, and Ebola. Recently, he became a commissioner of the World Council of Churches Health Commission and the chair of the HIV Reproductive Working Group. He will give us welcome remarks and he will lead us in an opening prayer. Reverend Christo.
Thank you very much, Gracia. Yeah, everyone, thank you for joining. This is a milestone conversation to have with one another. If we think how far we've come since the start of the HIV epidemic and how huge the stigma was at that stage when I just heard I was HIV positive. And for a long time, we were hoping to have more and more conversations about the church being the place where people with HIV and young people would be safe. And I think we've moved on greatly, and there's still a lot of work to be done. But the whole area about young people and safety and access is still an area of work that we need to continue to work on much more. So I'm very thankful that you joined us in this conversation. And thank you for all the participants who are going, or the panel members who's going to share their perspectives. But this is also a start of a process. We're focusing specifically in this one on the conversation with young people around safe spaces for young people in faith communities. But our working group on HIV and maternal newborn child health has identified that we actually need to listen more carefully also to other aspects of where youth can speak to us and where we need to listen to young people about the broader issues around the church and access and HIV. So I'm thankful that this is a start of a process that we will continue to do during this year. And we hope to learn so much more from young people around this. But thanks for joining. Let's start with a prayer. Lord our God, we thank you for your faithfulness. Thank you that we know you as the God of love and compassion, the one that embraces people in the midst of our pain and our suffering. And therefore, Lord, we also know that you have called your body to be your representative in this world. And as we gather together today, we want to learn from one another, from young people. We want to listen to the wisdom and the insights that come. And I want to ask, Lord, that you will guide us in our conversations, and that this will also be a meaningful conversation where we learn great stuff of what we want to take forward and how we can serve one another better. I want to pray for your church, your body, that we will continue to be your witnesses in the way that we love one another. We ask it that He will be with us in this meeting and guard over the technology and make sure that everything goes fluently. We pray in your name. Amen.
Amen. Thank you so much, Cristo. And very nice to see you in that lovely sun, which we are just gaining back in Geneva. I will go ahead and present Reverend Bishop Godson Dogbeda Teyi. He's a very dear person to the World Council of Churches. He is the presiding bishop of the Methodist Church in Togo. He has extensive studies, not only in sociology and theology, and extensive experience working on HIV, including with the World Council of Churches. He was the chair of the International Reference Group for the HIV program in WCC for many years, and he also now became a commissioner in the Health Commission, a co-chair of the HIV reproductive working group now, alongside with Reverend Cristo, and he will give us, he will present the objectives of this webinar, and he will also then later lead the panel, the brainstorming session, the open forum, where we will discuss the ideas of all of us. Over to you, Bishop Godson.
Thank you very much. Good afternoon all, or good morning all, depending on where you are. I'm very pleased to share with you the objectives of this gathering, this meeting. And when we talk about young people, youth, adolescents, we are talking about a specific culture, a specific language, a specific behavior, and also a specific model of life. And today, we are together to understand the perception of young people on what we call safe spaces, and also to analyze their models and perspectives of safe spaces, and also to analyze together as church leaders and young people, what are the changes and how can we create safer space for them, and how can we give them opportunities to dialogue and to discuss with us on reproductive health in their respective faith communities, youth association, and fellowship. And at the end of the day, together we can develop a list or criteria of safe spaces in their local communities and in their local context. I think that these are the 4 major points that we are going to follow, and the floor will be open to everyone to contribute and also to give their input. And maybe at the end of the conversation, we as church leaders and a little bit older man and old woman, we will be able to understand the challenges facing the young people today in the world. Thank you very much, Gracia.
Thank you so much, Bishop. Yeah, we need to understand the young people. We are not young anymore, long ago. Okay, let me introduce now Dr. Manoj Kurian. He is the director of the Health Commission. He started the HIV programs in the World Council of Churches. He will present the model of the World Council of Churches that has been used in HIV for the last 20 years or more. And we are not going to have questions after his presentation. We are going to listen to 2 more speakers and then the panel. Go ahead, Dr. Kurian.
The intergenerational safe space model has been developed in the WCC, and here are some of the, it is understood in the WCC, it's understood as safe spaces. as spaces of grace and compassion and encounters with communities that are marginalized and vulnerable. So the WCC understands its prophetic role as taking sides with the vulnerable and amplifying their voices and demanding justice, that justice is done done by advocacy alongside people living with HIV. So in the design of the intergenerational safe space conversations, it is designed in a way that there is conversation between faith leaders and young people and or affected communities. There is theological conversations on the topic that are related to HIV, including some of the difficult ones on sexuality, relationships, love, HIV, gender-based violence, etc. And the conversation starts with an agreement that the space is confidential and there should be no judgment and is not a place to convert or, and to coerce each other with their own opinions. And it's a horizontal, it's a round table, an equal table for discussion. So some critical features I can just highlight is one, it is trust. It has to be. We aspire to be trustworthy. That it keeps confidentiality. There is safety, both all physical, emotional, and spiritual safety. So they are not, So it facilitates listening and not judging, and acknowledges and respects each person. And of course, the whole process should make the person less vulnerable. It's a do no harm. We should not set out on a process that will make people more vulnerable. And of course, it facilitates dialogue. And most importantly, that it is accessible. There's no point having a very, very safe space which is not accessible to people. And we have also simplified processes to managing protocols to manage pre-existing power imbalances. So, and these changes, small, they maybe makes a big difference. How the positioning in the program and how the young persons are made, given prominence, etc. And of course, the respect and confidentiality, respecting that, and having a protocol that we do not share the contact information, HIV status of the people, etc. after the meeting is concluded. So we have to take these measures because it's not guaranteed, and we have to be intentional about this, and and the people need to be trained in doing this. So of course we also respect WCC policy to prevent sexual abuse and harassment, and there is a very strict code of conduct that has to be followed. We respect diversity of opinions and agree to rule out a judgment and eliminate moralization of issues. And we have in hand a list of organizations and services to refer to in case of needing counseling. And of course, we follow up after the activities for the well-being of participants. And most importantly, the following the principle of loving your neighbor as yourself. Thank you. I will conclude it there and we move on to the other presentation.
Thank you so much, Manoj. I will introduce now Alicia Sanchez. She graduated in Law and Political Science and holds a postgraduate degree on Social, Cultural, and Anthropology and Gender and Public Policies. She has over 15 years of experience working on HIV, sexual reproductive health and rights, gender, human rights, and youth and development issues at the country, regional, and global level. She has worked with community leaders, government officials, private sector donors, UN agencies, and many others. Currently, she is advisor on youth engagement at the Joint United Nations Program on HIV, UNAIDS. Welcome, Alicia. Over to you.
Thank you. Thank you so much, Gracia. And thank you all for having me participating in this dialogue today. I think it's the first time for me to have the chance to have a conversation with faith leaders and young people. And I really appreciate this opportunity. I really believe that faith communities are essential for driving the structural changes we need to see to end AIDS and also to ensure young people's well-being. So first of all, I'll talk about, provide a few reflections on why safe spaces are for young people should be important in the context of faith communities. I'll also talk about why safe spaces are critical for achieving meaningful youth engagement. We'll also go through the core principles of meaningful youth engagement according to the Global Sustainable Development Framework. And we'll also go through the barriers to meaningful youth engagement. I'll briefly touch upon the elements of youth-friendly services and how safeness is essential to the provision of services for young people. And I also talk about, like in UNAIDS experience, what are the main characteristics of safe spaces, and I will draw some conclusions as well at the end. Yes. So why are safe spaces so important? First of all, because there are 1.8 million adolescents and youth in the world today, and this is the largest cohort of young people in history. It is undeniable that this is a significant group in terms of demographics and achieving sustainable development. And despite that the rights to participate are embedded in the international human rights instruments, young people are still often and often considered incapable of participating, and their voices are underrepresented and underheard in public spaces. So by creating safe spaces for young people, we promote the right to participate and also create more inclusive and sustainable communities where each member of the group is appreciated and can contribute to the community's well-being. Next slide, please. Safe spaces are definitely essential are essential for meaningful adolescent and youth participation in sustainable development efforts. But what exactly is meaningful youth engagement? So there is a conceptual framework that has been built in recent years, which results from years of experience working with young people. So the definition I'm presenting right now it comes from the UN policy brief on meaningful youth engagement, which is part of the UN Secretary General's Our Common Agenda. So in this document, meaningful youth engagement refers to how young people should be involved in decisions and initiatives that affect and are important to their lives. And the document also mentions that when young people, when youth engagement strays from this principle, the risk is becoming tokenistic, and this can result in decisions that are divorced from young people's lived experiences and realities. And as a result of this, trust and confidence in social institutions are eroded, and decision-making is less effective. Next slide, please. So over the years, governments, youth organizations, and UN entities have developed a series of principles that, when implemented collectively, can help to ensure that youth engagement is more meaningful and effective. So if you notice, the very first principle is that for young people to be meaningfully engaged, participation spaces must be rights-based and safe. This means that young people should be informed and educated about their rights and empowered to hold adults accountable for respecting, protecting, and fulfilling those rights. Safe spaces also must be established, and safe spaces must also include measures, including safe referral systems to protect youth from threats and attacks. Other principles that apply in the Sustainable Development Framework that could be also important are mentioned here on this slide as well. So meaningful youth engagement should be institutionally mandated to avoid ad hoc participation, should be designated. This means that there should be seats designated for young people at all decision-making spaces. The participation of young people should also be resourced. Of course, should be transparent. This means that there must be a clear understanding on how young people's contributions are taken in and have also influenced decisions. Other principles are that the meaningful youth these spaces should be accessible, participation should be voluntary, should be informative, should be reciprocal, there should be reciprocal accountability. And one point that I want to highlight is that it should also be, we must ensure diversity and inclusion in these spaces, and this is a core principle. Another very important one is about the equal partners. So this means shifting the power dynamics, as the previous presenter mentioned, and that we need to work with young people not only as beneficiaries but also as partners and leaders. The next slide, please. There are a few barriers that that have been barriers to youth participation that have been documented. I'm presenting here a global guidance called Youth Next Level, which is a global framework to promote youth-led responses. In this framework, we have documented a few of the barriers that young people face when engaging in different spaces. One of them is, for example, the harmful gender norms that hinder adolescent girls and young women and young key populations' participation in public spaces. But we also see age-based discrimination towards young people, which creates negative assumptions about their capacities and their interest. And one very important barrier that they face is insufficient youth-friendly and safe spaces. Oftentimes, these participation spaces are inhospitable with, difficult languages, and do not consider safeguarding measures and mechanisms to protect young people from abuse and exploitation. There are other barriers, such as the lack of capacity building opportunities for young people, the lack of capacity building opportunities also for adults to know how to integrate these meaningful youth engagement principles in our work, and also the lack of recognition of young people as experts of their own realities, the lack of adequate compensation for young people when participating in decision-making spaces. And there are a bunch of other structural barriers, such as poverty, health condition, disability, you name it. Next slide, please. These are some core elements of youth-friendly services that also give us a hint at what's required to create safe spaces for young people. So this is a slide. Is these elements are according to the WHO and they highlight the elements that are necessary to consider any service to be youth-friendly. First of all, they need to be accessible. This means that young people should be able to access the services, both if it's going to a facility or is it the services brought to them. But the services also need to be acceptable, which means that adolescents are willing to obtain the services that are provided. A very important element is that services need to be equitable. This means that all young people in all their diversity, not just a selected group of young people, should be able to obtain the health services. There also should be appropriate. So this means that the right health services should be provided, not only those services that adults think are appropriate, but those services that young people demand and need. And finally, services need to be effective. This means that the right health services should be provided in the right way, and should be making a positive impact on health. The next slide, please. So zooming into the characteristics of safe spaces, and this is from the UNAIDS perspective, when working with young people, we have identified a few elements that should be intrinsic to safe spaces for young people. First, and most importantly, these spaces should be co-created by young people. This means that they must have the possibility of shaping these spaces, and the spaces should be a reflection of their needs, and their thoughts, their ideas, their ambition. Secondly, young people should be able to express themselves freely in these spaces. So if they can freely speak about their needs, experiences, concern, and be who they are, we cannot expect these spaces to be truly safe for them. Safe spaces should also be an open space for young people, so they are free to share their ideas without prejudices or judgments. And this is really a critical point. In the context of the HIV responders should also be able to learn and talk about their sexual and reproductive health and rights as an intrinsic aspects of their life. Safe spaces should also be free of physical, spiritual, emotional, and psychosocial violence and abuse. And finally, these spaces should also be non-discriminatory and inclusive. Should be safe for all young people, including those that have been, that usually are discriminated in society. The next slide, please. This is an example that I wanted to share about a safe space that we have created at the UN for working with young key population. This is the AYKP partnership. I joined an initiative led by youth networks with support from UN agencies to accelerate action led by and for adolescents and young key populations in the HIV response. So it's based on the priorities set by the networks themselves. The partnerships collate and disseminate knowledge on adolescent and young key populations. And Legacy is a suite of resources that they have developed to support different stakeholders, including faith sector, but also other development partners and government on how to develop effective programming for adolescents from adolescents and young people from key populations. The next slide, please. So, just to wrap up, just to say that some conclusions from these presentations. The final slide with the conclusions is about just a few key messages. Safe spaces are a critical element for meaningful youth engagement. Also, the principles of meaningful youth engagement should be implemented collectively, so we cannot take one element and isolate it from the others. They go all together. Also, addressing barriers for engagement should be considered when conceiving these safe spaces. Safe spaces should also be co-created by young people themselves, so it creates ownerships and appropriation. And to create safe spaces for young people within faith communities, it is really necessarily to embrace non-discriminatory, inclusive, and non-judgmental approaches, as well as protection measures. In the final slide, I will leave it with you because I included a few additional resources that you can consult in case you want to know more about meaningful youth engagement. Thank you. I'll stop here.
Thank you so much, Alicia. We are going to share all the presentations. We will put them in a link so that everyone can access them. Thank you so much. Let me now introduce Daniela Celaya Raudales. She joined the World Young Women's Christian Association in 2016 as an intern and now serves as the project specialist. She supports movement building initiatives, coordinates peace building, and advocates for young women leadership. Previously, Daniela was a board member of the Young Women's Christian Association at Honduras, where she volunteered as a peer educator on social justice, gender equality, and sexual health. With a background on communications, she is deeply passionate about feminism and empowering young women leaders. Welcome, Daniela.
Muchas gracias, Gracia. It's really exciting to be here, especially to share with you something that I'm very passionate about, and I've had the opportunity to engage not just with the World Council of Churches, but also with YWCA in different communities around the world. So let me first start with sharing a presentation that will just help us walk us through what we're going to be talking about, but also I hope that it's a tool or a way in which we can make this a little bit more interactive. First off, before I kickstart with sharing a little bit about the World YWCA experience or concept about safe spaces, I'd love to, if possible, if someone would like to unmute themselves or share in the chat, if you could share what is a safe space for you, and feel free to share examples. I mean, we've heard already like different perspectives from UNAIDS and from the World Council of Churches, but I'd love to hear from your perspective, like what does a safe space look like for you? And feel free to share examples. And I have the chat open, or you just feel free to unmute yourself. Would love to hear. Non-judgmental and affirming environment. Yes, that's that's something very important. To give you an example, for me, for example, when I was in Honduras, we used to have like in the kitchen, like have my like grandmother and aunts, and like we would be like cooking together. And that would be like a space, you know, in which we would be able to have like that non-judgmental and affirming environment. So just to give you an idea of an example of how would it look like, and I would love to hear through the presentation if anyone can share how would that look like from your own perspective. As we receive answers, I'm just going to jump directly to it in terms of what is a safe space for us at the YWCA. So for us, a safe space are online or offline places that seek to provide an environment where all people feel safe, comfortable, and can share their experience, opinions, and views without fear or threat of political, economic, or personal harm. I see Innocent raising your hand. Innocent, please go ahead. In the meantime, I see in the chat that Fatsai mentioned where I can speak freely and ask questions. Yes, that is also something very relevant in a safe space. Innocent, I'm not sure if you're able to unmute yourself, but I see you are raising your hand and we would love to hear what you...
Okay, I'm Reverend Innocent Chitanda from the UDAS, an umbrella board which represents the indigenous churches in Zimbabwe. I believe the safe space is when the church leaders will be able to accommodate young people's opinions, and when the church have got clauses which prevent the abuse of younger children. That's what I believe is a safe space from my church perspective.
That is really great to hear. Thank you for sharing. Yes, safe space is a place where we can build awareness on different issues. We can also bust myths that often, you know, occur. There is also an opportunity to discuss common concerns, talk freely, as someone mentioned already in the chat. It's also a space for validate experiences and stories. And this means, acknowledging another person's emotions, thoughts, and experiences, values, and beliefs. At the YWCI, for instance, we believe that there's a lot of power in stories. And many stories are shared in safe spaces. And often these stories, it's people sharing about their own experiences, at which we see it as knowledge, because when someone shares about their own experience, we believe that people are experts of their own lives. So what they are sharing, it's something that it's, authentic, and it can also be something that others can relate to and build like a stronger bond to do in community and also in terms of trust. I saw someone else was raising their hand, but now it was lowered. If you still would like to share, please go ahead.
Okay, thank you. I would like to add a comment about what safe space is. And my name is Jubilee. I'm from Safe Generations Organization, regularly working in Rwanda. And I think that safe space is where the young adolescents or people who have different generations can meet together, share everything, share their stories, and basically when it comes to SRHR, it is the place for sharing ideas, understanding, learning from each other, so that we can have a common purpose about everything. So if, for example, here at our organizations, we have safe spaces, and how we do regular works, we use dialogues with adolescents. We do regular work at schools and even in the community. Then when we meet in dialogues, every child or every adolescent share his story, share, clarify about, and learn more about SRHR. And it's time where you discuss about SRHR, and every youth who are engaged can understand and can learn from each other. And it is the good way for advancing what we can call peer-to-peer learning to each other. Thank you.
Thank you. I'm really excited with a lot of things that you mentioned, because we will deep dive a little bit more into it. I heard you mention intergenerational. I heard you mention peer education. And I think we are basically, have a lot in common in terms of like what do we see that are some of the characteristics of a safe space. I see also in the chat, people have shared that there is mutual respect, there is tolerance, there is cooperation, dignity, no matter who we are, accountability of each individual, trusting each other with our freedom and holistic behavior, cooperation from everybody. These are wonderful responses, and I dearly thank you for sharing. I see, Eva, you're raising your hand, but for time purposes, if you can keep it like very short, and then I'm just, for everyone else, feel free to share more in the chat. We are really keen to hear also like what's your perspective of a safe space. Please go ahead, Evat.
Thank you, Dan, for the presentation. Thank you for the question. I'm Reverend Canon Evat Mugarura from Uganda, Kampala, Uganda. I am involved in youth programs in many different fora. My response to your question takes me back. I asked a question and nobody wanted to answer it. What is new that we are trying to raise here that the church is not, the faith institutions are not doing, so that then we define the safe spaces in your own perspective? Because for us, the faith institutions have got structures that cater for young people, not different ages, children ministry, youth ministry, young marrieds, and all that. Those are the safe spaces that we know where people go in and talk about what you call sensitive issues, which are not actually sensitive, like sexuality is not sensitive in the faith institutions. We talk about sex, we talk about marriage, we talk about preparing for so many things. We talk about HIV. So I'm wondering what is new that we are trying to push now, that especially when we say in the faith institutions, that is not being done today. That would be more interesting for me. Once again, Reverend Eva Mugarura from Kampala, Uganda.
Thank you so much for sharing that. I think that's a really great question to ask. And well, in the case of the Worldwide WCA, and we've worked like in different, from different perspectives, but mainly our work has been more with women, young women and girls. And throughout our work, we have identified that there is certain aspects about the safe space that need to happen. And I thought, since we already heard many of them, and it seems, like there are many that you are more familiar with, I'd like to share a little bit of examples of like real cases examples that we've dealt with to sort of like give a better understanding of what we mean with each one. So when it comes to dignity and respect, well, it's in a safe space, like when there is dignity and respect, it's where people can support, inspire, and encourage and validate each other without fear of judgment and discrimination. So to give you an example, in terms of how does it look like in practice, we had recently an organization that hosted a youth summit that was focused on rural young women. If you think about rural young women, that sounds like one category, but there is no such thing as like that rural young women are all like this. No. So there were diverse women. All of them were rural young women, but they were from different faiths, coming from different backgrounds. And what happened is that the hosting organization like embraced that diversity and was able to create a positive learning experience, building on those, like acknowledging and recognizing like certain identities that were between that pool of women that were rural from young women that were rural from different perspectives. So that's one way of like how dignity and respect can look like. In terms of accessibility, I think one good example that probably many of you can relate to, because moving beyond the online, because accessibility, sure, we're talking about that it's a place where it's central to the participants. But what about when we talk about it when COVID-19 happened, when there was like this isolation and people were quarantined? So accessibility could also mean, that engaging through digital spaces and making sure that those digital spaces, are accessible for the different groups that you're engaging. We've had safe spaces, for instance, that take place in WhatsApp. We've had safe spaces that have been like a Zoom call, like similar to this. And it has been a great opportunity, especially for young women that felt isolated during COVID-19, to be able to come together within a supportive network. In terms of inclusivity, I think it's very self-explanatory, I find, but just to give also a story about, like a real story about how does this look like in practice. There was a safe space in which a young woman had her hair, spiked hair, and dyed in blue. And she felt a little bit uncomfortable because when she arrived into this space, it seemed like she was the only one who would stand out with this appearance. And what happened is that one of the people during the safe space, asked her about her hair. She said like, "Oh, how do you manage to keep your hair like so spiked up? Like, it's really interesting. Can you tell us more about it?" Or and that already made her feel like more a sense of belonging to the space. When it comes to language as well, language can be critical. We have had many safe spaces in which there needs to be done in local languages that sometimes, we need to understand that English is not, the first language for many people. So we also have to be patient in that sense. Safety and privacy, a space where confidentiality is really important, and so is consent. So, for example, we encourage a lot that people understand that whatever happens or is said on a safe space remains on a safe space. And this is very important when it comes to with very sensitive topics. We had a case of a young woman who shared her experience by being a survivor of domestic violence, and she broke in tears, and then she started apologizing because like I shouldn't have said that. And it felt like really reassuring for her when we, we revalidated her that, this is a safe space and this is nothing that you said will leave this space. So you rest assured, that you have nothing to apologize for. So, and that brings us as well to the aspect of trust and community. There was young women seeking help at the YWCA, and because she knew a friend, that has been there before, and sort of like explained to her a little bit of like how is the safe space dynamic, she felt easier to go to something rather than feel a little bit anxious because she didn't know what she was like going to, and that sort of also like helped validate her emotion and her experience of feeling anxious, but at the same time having an idea of what it would look like from someone that she trusts, like made her already feel more part of that community. When we talk about holistic approach, again, offering you an example, YWCAs, we talk about different topics, and some of them are very, like I mentioned, sensitive. For instance, we talk sometimes about sexual reproductive health and rights, and for some participants, it would be like really hard to just attend there to learn about these aspects, but also they realized that for some of them it was a little bit hard to be able to attend while taking care of their children. So for instance, there was like a space where there was where children could come, and or your women could come with their children. So it was allowing that it would be inclusive, and also from a holistic approach, acknowledging that there were also young mothers that were part of this space. I am running out of time, so I will go a little bit quicker. Where partnership and accountability, I think it was mentioned before, accurate and reliable information. This is very, very important, especially because of, like I said, there are moments that safe spaces are used to bust myths. I know that this happened a lot during the COVID-19 pandemic. Also during, there was a case of a woman who shared about how, details about how the menstrual cycle would be like 28 days. And there was this young woman who thought, oh, but my cycle is not 28 days, so there's something wrong with me. So then there was someone else who was able, to provide like the accurate information that would say like, yes, but it doesn't mean that it has to be like this for everyone. So that, was, it's really important to have evidence-based information. Very important to also have partnerships and accountability. This is also related. Imagine, having clinics or specialists that, can sort of complement or support so the safe space becomes also like a power space. Leadership and participation, encouraging others to speak, encouraging others to, voice what their concerns are, encouraging also active listening. And finally, we have intergenerational cooperation. And by this, I'm not just, referring to the young and the old, but also like try to break those stereotypes that sometimes come with age, and try to see it more as a really great space to do like peer learning or learn from one another. And well, like I said, that's how it looks like in practice. And I will share in the chat like the link to the tool of the World WCA spaces that we have, which I invite you all to take a look at. We're always excited, to be able to expand our tools above and beyond. So great to thank you so much. And sorry if I took a little bit more time.
Thank you, Daniela. So this conversation that started, some of you put in your questions on the chat. You continue that because we are going to do that, but we need to listen to the young people. So now 3 young people will talk to us. First one is Elizabeth from Nigeria. Elizabeth, you're there? Because she was having some problems with connections. Elizabeth?
Yes, I'm here.
Okay, good. So Elizabeth is from Nigeria. She's working with the Association of Positive Youths Living with HIV and AIDS in Nigeria, APIN. She also works with the Global Network of People Living with HIV as End Pediatric AIDS in Children, EPIC Champion. That's how they call it. She has also worked with the International Community of Women Living with HIV West Africa region and the Association of Women Living with HIV in Nigeria, ASHWAN, as a gender-based violence advocate. And she is featured all over the world. I met her personally in Nigeria. She's an activist, and I'm very proud of you. Thank you for being here. Tell us your perspectives on safe space, Elizabeth.
Okay, thank you very much, Ma'am Gracia. Thank you, everyone. Hello, everyone. I'm so glad to be part of this webinar. And when I got the message to be part of it, I knew it was going to be educating, and the awareness is going to be really, really good. So I'm speaking on fostering safe spaces for young women living with HIV in faith communities. Well, first of all, creating a safe space, inclusive and supportive environment for young women living with HIV is...
Elizabeth, I'm sorry. I'm just going to ask Marcelo to share your presentation, please. Thank you.
Okay, please.
Okay, thank you.
All right. Thank you very much, ma'am. Yeah, creating a safe space, inclusive and supportive environment for young women living with HIV is essential within faith communities. By addressing stigma, promoting understanding, and empowering these individuals, faith groups can become a vital source of comfort and resilience. First of all, we're going to be looking at understanding the challenges young women living with HIV in faith communities face. So first is stigma and discrimination. Young women living with HIV often face stigma and discrimination, which can make them isolate themselves from these communities. Secondly is lack of awareness. Many faith leaders and community members lack the knowledge and resources to properly support young women living with HIV. And emotional barriers. These can be, emotional barriers can be born out of the idea of feeling different due to circumstances, either by being a single mother or might have some experiences of sexual violence. This creates feelings of shame, fear, and isolation that can prevent young women from seeking the spiritual and emotional support they need. So these are the challenges, and we're hoping that after this webinar, we'll be able to tackle some of them. And essential characteristics of safe spaces for women living with HIV and AIDS in faith communities. Well, fostering safe spaces for women living with HIV in faith communities requires supportive and non-judgmental atmosphere, providing accurate information, promoting empathy, and ensuring confidentiality are essential. Empowering young women to share their experience and offering resources for emotional and spiritual support are also crucial. By creating an environment where women feel safe and supported, we aim to break down barriers and foster a sense of belonging. In these safe spaces, women can find solace, understanding, and a community that uplifts and empowers them. We believe in the power of sharing stories and providing a platform for women to express themselves without fear of stigma or discrimination. And our commitment extends beyond just providing information and support. We actively work towards addressing the unique challenges faced by women living with HIV and AIDS in faith communities. By collaborating with other organizations and advocating for change, we strive to create a more compassionate and inclusive future for everyone. We're moving to... So I'll be moving on and trying to get them to move to the next slide. Ma'am, please. Okay, thank you. So the role of faith communities, first we'll be looking at compassion and acceptance. Very importantly, faith communities can foster an environment of unconditional love, acceptance, and support for young women living with HIV in faith communities. Spiritual guidance, spiritual leaders can provide young women with the emotional and theological support they need to navigate their faith and health journey. And we look at community engagement. Faith-based organizations can facilitate support groups, educational programs, and community outreach to empower young women living with HIV. All right, I'll just move on because of time. So the next one is fostering a safe and inclusive space, steps to fostering a safe and inclusive space. So the first one here is education. Educating faith community members on HIV and dispelling myths and promoting understanding is very important. And secondly, we have policies and practices. So developing inclusive policies and practices that protect the rights and dignity of young women living with HIV is essential. And of course, we have peer support. We have we need to facilitate support groups and focus group discussions, and have membership programs to connect young women and build a sense of community for these young women. And the next one is addressing stigma and discrimination. Well, theological reflection. We need to encourage faith leaders to examine their theological views on HIV and promote a message of compassion and non-judgmental situations where people can actually come without the fear of being judged. And of course, we have community dialogue, where we facilitate open discussions and workshops to address misconceptions and promote understanding within the faith community. And then advocacy and allyship, empowering young women to speak out against stigma and encourage allies within the faith community to stand up for their rights. And also policy change, working with faith-based organizations to implement non-discrimination policies and practices to protect young women living with HIV. And then one of the ways we can actually end stigma and especially self-stigma is to empower young women. So of course, knowledge is power. So education is very important. So when we provide young women with HIV, when we educate young women living with HIV with maybe basic educations and of course life skills training and all, we actually build up their confidence and help them, fight self-stigma better. And then there's community engagement, when we encourage young women to actively participate in faith-based activities and community outreach initiatives. And then there's leadership development, where we nurture the leadership potential of young women living with HIV and empowering them to become agents of change, like activists and advocates. You get them to speak up and stand for other people, other young women living with HIV as well. And then there's self-care, where we promote the importance of self-care, mental health, very importantly, and overall well-being for young women living with HIV.
I don't know, we lost Elizabeth. Okay. So I will follow with Elizabeth maybe to see if she can reconnect and say the last points of her presentation. She was coming to the end. Some people put questions on the chat. I will respond to some of them and also the speakers, but not now. We are going to first listen to the other young people with HIV, who is, one of them is Yao Amega. I will introduce him to you. He's a dynamic and passionate young man who has been involved for several years in the fight for social justice and the well-being of young people. Originally from Togo, he has devoted his energy and enthusiasm to promote the rights of young people, particularly in the fields of HIV-related stigmatization and gender-based abuse. He promotes safe and secure spaces as a means of ensuring young people are fulfilled and have a fulfilling and responsible life. Welcome, Yao.
Thank you very much, Mrs. Gracious. Thank you, Elizabeth and Daniela, for this qualitative experience sharing. Hello, everyone. Today, I'm delighted to talk to you about safe spaces for young people in our communities. Thank you very much, Marcelo. As a young person committed to social justice and youth advocacy, I firmly believe in the importance of creating an environment where young people can express themselves freely, grow, and flourish. In this presentation, we will explore the concept of safe spaces for young people. We will discuss what makes a space safe, the importance of safe spaces for young people, and the challenges of creating and maintaining safe spaces. And in the end, I will share a personal experience related to the topic of safe space that helped me improve my self-confidence. Firstly, what is safe space? Next slide, please, Marcelo. Next again. Marcelo, please, next slide, please. Thank you very much. A safe space for young people is physical or virtual environment where they can feel, accept, respect, and value without fear and of discrimination or judgment related to vulnerability or status. It's a place where they can be themselves without shame or fear, where they can express themselves freely and share their experiences without facing stigmatization. Let's take a concrete example. Imagine a shy young girl who feels uncomfortable at school. In a safe space, she can meet other young people who may share her shyness, who have similar experiences. At last, she can express herself freely, ask questions about her doubts and difficulties without fear being laughed at. A safe space is also a place where young people can be themselves without shame or fear. For example, another example, a young person with a passion for drawing can share his artistic creations and receive encouragement without fear, hurtful criticism. Please, Marcelo, next slide, please. Thank you. What the essential feature of safe space? In this part, let's start by defining the essential element of safe space: identity and self-expression. A safe space offers a haven where young people can explore their identity, passions, and talent without fear and judgment. It's a place where they can be themselves and express themselves freely. For mental health and well-being, safe space place paramount importance on young people's mental health and well-being. They offer activities and resources to help them manage stress, overcome difficulties, and develop a positive self-image. Fighting discrimination and prejudice. Safe space reject all forms of discrimination and prejudice. They promote inclusion and respect for diversity of all kinds. For sexual and reproductive health, safe space address the issue of sexuality in an open and inclusive way. They provide young people with accurate, scientifically-based information on sexual and reproductive health, enabling them to make informed decisions about their health and well-being. How is the subject of self-death within a safe space? Sexuality is an important and sometimes delicate subject for young people. In safe spaces, we talk about in a respectful, inclusive, and guilt-free way. qualified professionals lead workshop and open discussion, enabling young people to ask questions and obtain reliable information, please. There are also accessible documentary resources adapted to their level of development. In self-space, discussion focusing on sexual and reproductive health help to create a safe and open environment where young people feel comfortable asking questions and exploring their sexuality without fear and judgment or discrimination. It helps to promote mutual respect and consent in sexual relationship. Finally, safe space helps to empower young people to make informed decisions about their sexual and health well-being. Next, thank you. Thank you very much. Here we will see the advantage, the benefit of peer education and mentoring. Peer education and mentoring are two fundamental pillars of safe spaces. Peer education enables young people to learn from their more experienced peers. The latter, trained to become peer educator, can share their knowledge and experience on a variety of topics, from sexual health to stress management. I'm a great example of this, as peer education saved me from suicidal thoughts. For mentoring, self-education offers young people personalized support from a trusted adult. This mentor can advise, encourage, and support them in their personal development and specific life career. Next slide, please. Okay, I have just talked about that slide. Please, next slide, please. Okay, please allow me to share with you short experience with my short experience with safe space. I'm one of two sons of young people rejected by their own families because of HIV infection. This situation not only pushed me into precarious situation because even though I took refuge with my half brothers and sisters, it was difficult for us to meet all our needs. I went to school in the morning and worked after school to find enough to eat and pay for my education. If I could settle this part of my life, the best settle will be the right ticket to succeed. To succeed, being overwhelmed not only by the daily difficulties of making ends meet, sleeping in corridors or in church, I had also internalized all the form of devaluation associated with HIV. So I began to multiply my suicide attempts either with the overdose of antiretroviral treatments or by deliberately causing road accidents by throwing myself in front of cars, which even caused me to limp on my left foot today. But God loving me enough, whatever my attempt, I was still alive. I owe my current leadership and self-confidence to the peer education groups organized by my care center and WCC area in West Africa. I made friends, share my fears openly, and learn from peers how to overcome the problem. The intergenerational session that area WCC also organized in Togo helped me to build up my self-confidence, highlight my qualities, and build a network that I can count on when I'm feeling down again. As you will have guessed, ladies and gentlemen, I'm the pure product of safe and secure spaces. Without these safe spaces, I would be this model of leadership for other young people. Without their space, I wouldn't even be with you at this very minute. That's it. Safe and secure spaces need to be multiplied while preserving their values. Their space need to be promoted. Their space need to be perpetuated. Next slide, please. Okay. can we create a safe space for young people? Creating a safe space requires trust and commitment. Here are some key points to keep in mind. A warm, welcoming environment. The space must be physically and psychologically safe and conducive to exchange. For the first, involving young people in the process of creating and maintaining safe space. Have a plan for managing cases of bullying, harassment, and discrimination. Train caring facilitators. Facilitators must be good listening, competent, and able to create a climate of trust. Basic rules define limits and guarantees safety for all. Thank you. Thank you very much.
Thank you. Yao, thank you so much for sharing your own examples of how a safe space could work if it's safe. Elizabeth reconnected and she had two more slides, I think, or one. So you can just explain that, Elizabeth, and then we go to Sadie.
Oh. Okay, thank you very much, Ma. Sorry about that brief. I had bad network. So I was on collaboration for change, and I had faith leaders. So here, I was saying that faith leaders play a very crucial role in creating a safe and inclusive environment for young women living with HIV. And of course, healthcare providers. I won't take much of your time. Healthcare providers can work alongside faith communities to address the unique needs of young women living with HIV also. And community organizations, we have community organizations who can partner with faith groups to provide resources, support, and of course, advocacy for young women living with HIV. And then we have, towards a more compassionate future, that's our goals. We have stigma reduction, faith-based education and dialogue to challenge misconception and promote understanding, and inclusive policies, understanding development of non-discrimination policies and practices within faith communities to protect young women living with HIV. And of course, we have empowerment, which is providing young women with the resources and the support, and of course, the opportunities to thrive and become leaders in their communities. And then we have collaborative efforts, strengthening partnerships between faith leaders, health care providers, and of course, community organizations to create sustainable change. And I think that's it. So thank you so much for listening. Any questions?
Thank you, Elizabeth. Yeah, stay online because we will have questions right after Sadie. So now it's my pleasure to introduce Sadie Brown. Sadie Brown is a queer woman who was born with HIV and learned about her HIV status at age 14. She uses various social media platforms to educate people about HIV. She works with quite a number of organizations and has been on social media campaigns that work on educating people on life and living with HIV. She has been an advocate for the inclusion of queer women living with HIV. In conversations about HIV, she's also interested in women and girls knowing and being given the space to learn about their bodies and right to sexual health. Welcome, Sadie.
Thank you so much, Gracia. Hi, everyone. I'm Sadie, and I am a queer woman living with HIV based in South Africa. Now, I have not always been safe enough to even say that or introduce myself this way. And this already shows the unsafety we have to endure and internalize as people in the LGBTQIA+ community. Having to navigate a life with HIV as a teenager was difficult because of the stigma that came with living with HIV. Now, having to come out also about my sexuality was really hard. The intersection also meant that I'd have to come out twice. Creating a safe space comes with a lot of vulnerability and honesty, and these attribute greatly to making everyone feel safe. Safety is not something we all have in the queer community. There's a great need for unity within the community and a need for solidarity from society. The narrative has obviously changed for me as I'm now living openly with HIV. I'm working in advocacy, and I'm not scared of sharing my life and experiences. However, there's a great privilege in even being able to do that or even say this in such platforms. A lot of our queer siblings cannot even express queer joy in their everyday lives. How do we even begin to celebrate Lesbian Visibility Week when we have queer siblings in Ghana and Uganda fighting for their right to live and their right to exist loudly and proudly in who they are? We also don't realize how isolating these laws actually are because we are blinded by our own privileges and prejudice. Queer women living with HIV can't even navigate sexual relationships with their partners because there are no spaces for us to even articulate our struggles and misinformation. Men who have sex with other men are in the key population groups for people living with HIV. If they cannot get empowered in destigmatizing HIV through treatment and through HIV prevention methods, HIV infections will keep on rising. This is a human rights fight, and it is a fight that affects all of us, whether we are aware or like it or not. I'm calling upon faith leaders to work with us in facilitating safe spaces for us. The truth of the matter is that a huge part of homophobia comes from religious views. Now, God is for all of us, and for us to find the God within us, we need to love one another as we love ourselves, and we need to work together in making the world a better place for everyone. Let's start speaking about these things. For example, when was the last time you even said anything about the cruelty that our African people are subjected to? Let's learn to see each other as human beings first. There's a need for mental health spaces in our communities. Laws that criminalize us need to be removed. I cannot emphasize how hard it is for us to even have to ask for this. We can't keep debating whether we deserve to live or not. There should be mentorship programs in churches that foster safe spaces for the community within the churches. And we also need to foster these spaces that empower us to also cultivate a relationship with God who actually sees and loves us. It's important to remember that language matters and that we deserve respect and acknowledgement. We are here, we exist, we embody love, we deserve to live, and we love God as much as the next person in spaces that guarantee us of safety, love, and community. Thank you.
Thank you so much, Sadie, and thank you all of the speakers, particularly the last three ones, because they bring us back to things we need to learn. I will address some questions on the chat because they are directed to the World Council of Churches as we organize this. Someone was saying, what is new? And is this donor driven? Well, there are spaces in the faith communities for young people, but they are not automatically safe because faith communities and the other communities are not automatically safe for young people. Actually, to the World Council of Churches, we have been told that our spaces not always are safe because of the issues of sexuality. So that's why we have this webinar, in order to acknowledge there must be some changes we need to do in order to make the spaces safe for young people, not for the ones who are on leadership, not for myself, not for anyone who is working in any organization, but for the young people. So we decided to consult again and review, and we are willing to collect like a list of characteristics of this safe space in faith communities and adjust our work, because it's not perfect. And we tried to express this in the presentation Dr. Kurian did. I don't know if it came clear, but we say clearly that our spaces have not always been safe. And the same you can say about other spaces in faith communities in the countries. But I'm not going to say more about that. We can then have a conversation about the spaces that the World Council of Churches created. I think it's more important to focus on what we can do in the future with the young people and not for the young people. Now we are going to have an open forum where everyone can talk. We put some questions to try to guide the debate. Marcelo will put them on the chat. Some of those you already kind of responded. And this open forum will be moderated by Bishop Godson. I leave it to you now, Bishop Godson. And then on our agenda, we also had some brainstorming. So if you have ideas of what a safe space in faith communities could be, we know it hasn't happened well. You can already start putting these ideas in the chat. In a later moment, we are going to call you again to kind of review this list and have a second conversation about this. So Bishop Godson, with you now.
Okay. Thank you very much. Thanks to the panelists and those who make comments during this meeting. I would like to draw our attention to the fact that when we are talking about safe space and we talk about emotional, physical, we need also to talk about spiritual space. Sometimes our prayers and our preaching sometimes created unsafe space for children, for youth, and for those who are living with HIV. So it is important to put spirituality under all these activities as far as the church settings are concerned. Now, I'm going to give us the floor, and question 1 is working on HIV with young people in faith communities. How does a safe space look like? I would like to introduce this question by saying that, can you imagine during a worship, you have an announcement from the pastor or the reverend minister saying that, okay, after the service, we are calling all the people living with HIV and all the key population to come because we want to pray for them. Is he creating safe space, or is he creating problem to our neighbors and our friends? The floor is open now, please.
We are calling all of you to tell us what needs to improve.
We have Adele, please. Adele, can you go ahead?
Okay. Thank you, Reverend. Good afternoon. It's afternoon here in Nigeria. And I want to say a very big thank you to all the presenters. Their presentation has been quite insightful, and I like to add, essentially, not to respond to the question directly. I mean, looking at safe space within the faith community, I think it's something we already have that exists, because if we look at the faith community, we already have the youth network, the children angle, and we have all these structures already existing. So I think what is important for us is to look at how can we make all these network and these spaces sensitive to the emotions of the target population we are discussing. I mean, people living with HIV, the key population, and all that. How are the people entrusted with the coordination of this network, this group of young people? Are they sensitive, to discussing issues around sexuality, issues around HIV, issues around equality among these young people? I think that essentially is where we are, because when we say safe space, we're not looking at something completely different. It's something we already have that is existing. But how can we maximize the opportunity, the platform we have to actually make these spaces indeed safe for young people to be able to access some of the services within the faith community? Thank you, and over.
Thank you very much. Innocent Chitanda.
Thank you. I think in order to create a safe space, I think it must begin at leadership level and also and then secondly, at theological and ethical level. Just because I believe as a church, some of the sermons and some of the policies which are in the church, they are discriminating people who are living with HIV and AIDS. For example, most of us leaders will regard sin as the causes of HIV and AIDS. Yet, if you start further, you know that there are some people who did not commit sin who are now living with HIV. We know that there are several people who are now suffering because they did not commit any sin. So I think in order to create a safe space, we need to change the way how we preach. Here in Zimbabwe, I think we've got an example of a church, a cult leader, who had created a place called Canaan, where he was using to take advantage of vulnerable groups and also making sure that he cleared a rigid boundary that his community was not interacting with the other community in the country. So I think in order to create a safe place, we at ecumenical level, we must also help those people. I know that as churches, we are at a different level. There are some churches where we have got a lot of resources, and then there are some churches which are beginning to develop. So I think those churches who have got a lot of resources, it is good for them to support those upcoming churches for the benefit of the vulnerable groups like people who are living with HIV, women, and people who are with a disability. Thank you very much.
Thank you very much. Innocent, can we have Ivat Mugarura?
Yes, thank you, Bishop. Yeah, thank you very much. Once again, I want to say a few things, and I want to answer your question, respond to your statement directly. First of all, different countries are at different levels of HIV response, we must admit. In my country, Uganda, HIV is something that we have taken on in a very long time. I was part of the teams, the initial teams that embraced HIV when everybody didn't want to hear anything to do with the HIV, taking it as sinful. But we no longer define HIV or someone living with HIV as a sinner. We have graduated from that. There are certain things we don't do for purposes of, we have to be on the safe side of the law of the country, but also we have to be conscious of what we are meant to do. I hear you when you talk about rights. These days we are saying, what about my values? Why don't you respect my values so that it is also a right? And that's where we find problems. And so for the priest in a church to say, you people with HIV and the key populations, people come and I pray for you. Of course, that one I don't expect in my church. That should be in a cult or somewhere, but not in my church, because that's failure at duty. We interact with these people, we support them as much as we can. Every human being has an issue, has a problem. How do you manage all these multifaceted problems as a religious leader? That is our custodian, within our custody. The problem I have is that you want to tell us what to do when you are not part of us. First, to know what we do and how we do what we do. Then you come, turn around and say, oh, there is this is good to build on. this is a good model to scale up, or this is not good. But you come and impose everything on us, and no wonder we resist, because we don't see you participating with us like you are talking. You want participatory approach, but you don't use it when you are designing these models and policies with the concerned parties. That's where I have a divergent issue with you people. Thank you very much.
Thank you very much. Thank you. Thank you. Let me tell you that before becoming a bishop, I was the youth executive, and I can understand what you are saying. Can we share now the third question? How do participants of the space keep this space safe? How do we keep our space safe?
But also, Bishop, if people have another idea which is not in these questions, we also need to hear this. So you are also welcome to give those ideas, opinions, dear participants.
Okay, please share from your contest what you want to share, please. Mr. Tucker, please. I can see that you are a young person. Yeah, Adeleye is there. Please go ahead.
Okay, thank you, Bishop. I will touch a bit on the question you have raised, and I mean also try to speak a little bit more of what I have said earlier. You know, I've mentioned that we already have the space in the faith community. But how can we make this space? How can we make them safe? So essentially, what we need to look at, what are the typical characteristics of a safe space? A place whereby you're able to express yourself, a place whereby your confidentiality is not threatened, a place whereby you are not stigmatized or discriminated, irrespective of what you believe in and what you want. A space whereby, because I understood from what the last speaker has said, you know, when he said this is where he doesn't agree because of inclusivity when some decisions are being made and all. I think everyone, you know, have the right to identify with their own sexual orientation, because what pleases A doesn't pleases B. So I want a space whereby, irrespective of what I want and how I choose to express myself, I am not discriminated against and I technically have a voice. A place whereby, if I have a concern that has to do with my sexual rights, my reproductive health and everything, I am able to go there and get the kind of help I need. A space whereby a young lady was probably raped, and instead of the young lady being offered help, she's being condemned, perhaps because of the way she dressed or something, or the way she conducts herself. So when we're talking about the safe space, we want a place whereby, you know, young people are able to express themselves and tell what's actually wrong with them. And because of perhaps the perception of what the faith sees about that, we do not condemn them. Rather, we are able to, you know, accommodate and guide appropriately the way the faith's response could actually be. Yes, somebody could be, let me cite a very quick example. Someone could be indulging in drugs, and this person is part of the youth community in the church. Naturally, we want to say, drug is bad, it is not good, you are not a child of God if you indulge in that and all. And what happens to such a person is to withdraw from the space and, you know, run away, keep what he or she is doing. But however, if such child is being able to, you know, accommodate and understand why he or she is indulging in that, then we are now able to pass across the dangers, the fact that the faith does not allow that, the fact that it's dangerous to such person's health. If we do not have a way we go around this, it might actually allow young people to withdraw, and we are not able to intervene appropriately around sexual and reproductive health issues for young people. So these are some of those things we want in the safe space. And I think the faith community already has the platform, but how well can we, utilize? I'm going to put it to WCC that perhaps we now need targeted trainings, targeted messaging for people that lead the faith community to understand this concept of not, rejecting or talking down on young people, rather finding a way to understand some of the issues they face, and we are now able to intervene appropriately. Thank you, and over.
Thank you very much. Can we give the floor to Madam Sanchez Alicia?
Okay, yes, just one thing I wanted to bring to the conversation is about the role of faith communities in creating safe spaces, in really, promoting and changing discriminatory environments. Because I think we need to remember that safe spaces within the faith communities do not happen in a vacuum. So they are influenced by their, the social, the cultural, the legal, and the policy environment in a certain context. So I wonder, for example, how if the country criminalizes people living with HIV, or any issue related to living with HIV, how people living with HIV could feel safe even within, this so-called safe spaces. And that is a risk for a person living with HIV, or for a person from a key population, from an LGBTIQ person, if those characteristics are criminalized in a certain country. So I wonder, what's the role of faith communities also creating change in their local environments. I feel like, coming from UNAIDS, that it's so important to work with faith leaders and faith communities to advocate and for creating safer environments for people, regardless of their HIV status or sexual orientation. So that's one point that I wanted to also share with you and bring to the conversation. Thank you.
Thank you very much, Madam. Dr. Rini Thomas.
Am I audible, sir?
Yeah, you can. Go ahead, please.
Yeah, I am from India, Father Dr. Rini Thomas. I just want to share my basic understanding regarding the safety issue. We are talking about the safe places. How do we come across the threat of having unsafe places? It is regarding the human attitude. It's all, even if it is connected with social and cultural factors, there are some psychological aspects also. It's really coming from the human mind. Then why we don't like anything? It's because of that we don't have the proper understanding of or awareness of that thing, or we don't like that. Regarding the people living with HIV, there is a stigma or a discrimination in each and every society. As I have earlier said, that there are some social and cultural factors. Other than that, we can go look into the psychological aspect, that the lack of information is a first thing regarding HIV, and how the people are getting infected, what's the situation, how do they live, how do they survive, and other than that, most of the people may be having a negative attitude, or they don't like those people like that. For that, we can do two things. We can have the awareness programs, even though we are ahead of various projects regarding the awareness regarding HIV and people living with HIV. Very shortly, I have completed my PhD in children living with HIV. I have collected data from the four of the southern states of India, and I had a mixed study, and I visited various institutions which provide residential care for the children. And regarding that, regarding the southern area of India, I would suggest we can have, even though we are ahead of various awareness programs, still we need, still there are population that even don't know about the basic concept of HIV. And second part is that the process of accommodation. If we don't like anything, we hate anything, how we can make the people to accommodate or get connected with that? That is by making the people to understand the living situation of the people, and regarding them as the human beings, and caring and loving for them. Thereby, we can put forward the awareness, and at the same time accommodating each and every individual living with HIV. That's my basic thought.
Okay. Thank you very much. I think that I can see even two hands hanging, Evat and Amega, but we are now in the process of closing the meeting. May I ask now Madam Gracia to take the floor and give us the direction.
Yeah, thank you so much, Bishop Godson. And we are keeping a record of all these questions that were there, and we are also recording the webinar. We want to analyze these topics and come back to this discussion because it's so important, and we have to keep track of why we are doing this. We are doing this because the spaces in faith communities are not always safe for young people, and we have to make some changes. There is still a stigma around, and we have to solve this. This will not be an imposition, but it will be an invitation to do things in the good way, in the way that God wants us to act, loving our neighbor as ourselves. But we are going to come back with the ideas of this webinar in another moment. I think maybe after the AIDS conference, when we have like a better collection of the ideas, because now it's like a brainstorming. We are willing to put this in a small document, which will be a guideline. It will not be for everyone. It will be for WCC and for anyone who wants to use it. And we hope the young people will be the ones to approve it, because we are doing this for young people. Now we have to come to the conclusions, and we are going to ask Brian. Brian Muyunga is a young African theologian, currently serving as the executive secretary for youth in the All Africa Conference of Churches. Since he was 12, he has been actively involved in leading faith-based and community-based initiatives to eliminate the spread of HIV and AIDS among young people and adolescents. He is a member of the World Council of Churches Executive and Central Committees. His research and publication interests include religion, the relationship between religion and public health, gender, and African ecumenism, among others. Brian will give us some ideas of possible actions or conclusions and next steps, but it's not the end of the conversation. So go ahead, Brian.
Thank you so much, dear Gracia, for that very gracious introduction. Friends, brothers and sisters, I'm happy to join you this afternoon, at least here in Nairobi, where I'm joining you from. I'm so happy about the session that you have had from the time when it was introduced by Bishop Lawson, giving us the objectives as to why we met today, really to get to understand the perspectives of young people when it comes to safe spaces, but also how we can create safe spaces for young people. I'm sure we have achieved the objectives of this session. I was so excited to hear my brother Yao actually highlight the fact that matters of sexual and reproductive health are very delicate and crucial and require a very sensitive and inclusive approach. That cannot be denied, and that can never change. And if we are committed to working for a better world, free of HIV and AIDS, free of suffering, a world where human dignity is protected and preserved, then we have to be attentive to this reality that was expressed by my brother Yao. Basically, what I had mainly is not different. The perspectives of the young people on safe spaces, for me, actually conform to what the WCC or the UNAIDS defines as a safe space. For example, from the presentation of Dr. Manoj, I quickly deduced that according to the WCC, a safe space is an environment where people can engage, and in their engagement, feel the virtues of trust, of safety, of confidentiality, honesty, and security preserved and guiding that space. And our sister Alicia from the UNAIDS defined for us a safe space from the UNAIDS perspective as a platform or an environment of interaction that fosters meaningful participation of youth, especially when it comes to sexual and reproductive health and rights issues. She emphasized, which I think we should note from this discussion, that our safe space should be free of spiritual, physical, and emotional harm. That's very, 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 very important, irrespective of the topic that is being handled there. We have to ensure that the space is free of any form of spiritual, physical, and emotional harm. Daniel was able to give us a demonstration of a safe space as an environment where people are freely interacting without fearing of any bias of being judged. And I think we need to carry that forward, which is a very common thing in many cultures, even here in Africa, where young people and their parents or grandparents sit around a fireplace and they catch up on life without anyone, fearing of intimidation or anything. That's, I thought, aligned very well with what the young people ended up highlighting as characteristics of safe spaces when Dan invited them to share. I had aspects of transparency. A safe space should be that space which fosters transparency in interaction, and a space where people feel free to express themselves. People feel free. The space is free of stigma. There is respect, there is inclusivity. People can share with honesty and openness. No one is fearing being judged, and people are assured that whatever they are sharing is not going to be used to harm them or to be used in any way against them. I noted in bold that safe spaces might bring vulnerability, especially when it comes to marginalized communities. And if we are creating safe spaces, then we have to be alive to that factor. Brothers and sisters, friends, we have learned from this session that it is a responsibility of all of us to create safe spaces. But we cannot create them with an approach of thinking that young people are mere beneficiaries. However, they should be partners in the entire process, from the point of conceptualization to the point of actually making the space work. And how do we do it? Is by working with them from the word go. We have to work with the youth and not for the youth. That I think we should also quote with boldness. How do we create safe spaces? First of all, we have to be intentional. I had this come out through. We have to be intentional in creating mentorship programs within our churches. We have to be intentional in ensuring that there is support for the young people, especially when it comes to promoting sexual and reproductive health and rights. We need to focus on what we can do with the young people. What is it that we can do with them is very important. And we have to be sensitive to the emotions of the people that we are creating the safe spaces with and for. But also, we have to note that creating safe spaces is a matter of leadership, ethics, and also morality. Finally, from this conversation, we spent some good time also interacting on how do we keep the safe space safe. It goes back to the same point of how do we then create safe spaces. The issue is it's about being intentional. If we're intentional about keeping the space safe, then we are able to do whatever is within our means. We are able to interrogate our theology. We are able to interrogate our worldviews. We are able to interrogate even our perspectives on the different issues to make sure that the space remains sensitive to the emotions, to the well-being of the people involved, but also free of any kind of spiritual, physical, and mental harm. But also, we have to continue listening to the young people because their realities keep on changing. So for our space to remain safe, we have to continue listening to the young people and being open and willing to even actually be flexible where it requires flexibility in how we are doing things. Thank you so much. I'm looking forward to the next session we will be having furthering this conversation.
Thank you so much, Brian. Thank you so much, everyone. I will use my papers because I don't want to forget anyone. Thank you, Christo, Bishop Godson, Dr. Manoj Kurian, Alicia, Daniela, Elizabeth, Yao, Sadie, and Brian, and Marcelo, who was helping on the presentations, and all of you that put your questions on the chat, your opinions, even the opinions that are not praising WCC, we take them. I want us to learn from what you are saying and continue having these conversations. We invite you to review them link that Marcelo provided, where he uploaded all the presentations that you heard today. This recording will be on the website, on the YouTube channel of WCC. And I think maybe in 2 months or so, we can have another conversation with a better idea of how a guideline for faith communities to create safe spaces for young people would look like. This should be a short document that we can all use and adapt to the context that we are in. So it's an invitation to let's meet each other again very soon. Thank you for engaging in this important conversation. And bravo, aplausos in Spanish, claps for all of the speakers and participants. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.